is Adelita, and I'm here today with Dr. Mark Chavez, who goes by the Health MD on all his social media platforms. He is an author, he's a speaker, he's an inventor, he's a health advocate. Did I miss anything?
No, that's good.
Okay, great. So today I'm really happy that you're here and to be able to discuss what is going on, the situation where people are trapped at home. There's a coronavirus scare. A lot of people are afraid. And I would like to see what you can tell us from your point of view on how people should stay healthy and how any tips for people out there.
Sure. Actually, the coronavirus is not any different from any other respiratory virus. Influenza, the avian flu, they're all transmitted primarily through aerosol and through airborne, hence coughing and sneezing. So just like any other flu, when someone's sick, you try to avoid being around them. Even, unless they're your baby and you have to take care of them, or they're your loved one. But that's just sort of common practice amongst us. We see someone sick and they have a temperature, they have a fever, they're not feeling good. Well, we tend to stay away from them. This is exactly the same thing. And we tell people who are older, who may have a weaker immune system, or people that have a lot of comorbidities. And comorbidities, when you hear that word, it just means a lot of different conditions. They may have several different diseases that they deal with that are chronic. So that also lowers their immune system. The thing that's a little different from other viruses that the corona is kind of special is that it just gets transferred to people very quickly. Some other viruses, it's not as easy to transfer. And so it's very easy to transfer if someone has it to someone that doesn't. So you just do what you normally do. You stay away from people. You avoid large groups of people where you don't know them and they may be sick and they may be coughing and they may not even know that they're sick. But what social distancing does not mean is do not go outside or isolate yourself indoors indefinitely. And so you still want to go outside. You still want to get out and move. You want to breathe fresh air. You want to get some sun. You just don't want to do it in large groups with people right close to you that, if they're sick, could possibly transfer that virus to you.
I notice a lot of people are doing more and more these online meetings, virtual conferences online. That's another way where people can stay connected and still maintain some level of, being around other people in a safe way. And what have you done yourself to keep sane, to keep some kind of routine in place? What are you doing yourself, and how are you dealing with this social crisis?
Well, my actual routine hasn't really changed much at all. I'm still doing the same thing I was doing before this whole virus hit. I typically, unless I'm working in the emergency room, I'm not typically around a lot of people. I am an entrepreneur, as you mentioned, and I spend a lot of time doing writing, doing emails, doing Zoom calls before everyone is already on Zoom because of the social distancing. And so I still go outside. I run every day. I get my exercise in every day. So the only thing that's different is I'm just I think I've been trying to help other people understand how they can live and still live a relatively normal life, even though there are some precautions that they're taking, which they normally wouldn't.
I see. Well, I also know that you have a company where you invented a system where people can exercise at home called the gravity ball, right? I see that more and more now people can go out and go to gyms. I train jiu-jitsu. My jiu-jitsu gym is closed. Every major exercise places closed. So how wonderful it is to be able to have a system where you can have a gym at home. Could you please explain a little bit how that works and how if you're using that?
Yeah, so I created the gravity ball for myself many years ago. It's been over 5 years now. And really, I saw a need, especially in people that the concept was created from the need for to be able to allow people who can't grip things to be able to still use weight. And so there's a lot of people in this country, actually close to 100 million people in this country that don't use weight or do resistance exercise because
Mm,
they have trouble gripping things.
mm,
And so that has very huge consequences, as you know. If you're not able to do strengthening exercise, the consequences of that are dire, and you basically wither away. You lose your muscle, then that causes your bones to get weak, and that causes your metabolism to get weak. So this is much bigger than just doing some exercise for the pleasure of it. It's really about maintaining a healthy body, metabolism, and immune system. And so if 100 million people plus can't exercise with weight, that's a big problem. So the
mm.
thing that makes the gravity ball special is that it attaches to your hands and feet and wrists, so you don't have to hold it. It effectively holds on to you.
I have one here, so.
Oh yeah, there you go. So you just the way you're putting your hand through there, it's almost like a basketball player is able to palm a basketball. Now anybody could palm the weight of the gravity ball and use that weight effectively to exercise and to do functional movements. The nice thing about it, in addition to not having to grip it, think of it as a all-purpose, all-in-one exercise device, almost like a Swiss Army medicine ball. You
Hmm.
can do 100 exercises with that one device, including exercises that you do that require dumbbells, kettlebells, medicine
Hmm.
balls, foam rollers, and stretch straps. Those all could be done with that single device.
Wow, that's really amazing. I was fortunate enough that I was gifted one of these, but if people want to find out more and see for themselves or purchase one of these, where can they find this online?
The best place would be our website is gravityball.com.
Hmm.
And also our Instagram account is good to see the types of exercises you can do with it.
Hmm.
And on Instagram, we are at Gravity Ball Method.
Great, great, very nice. And other than exercising and being mindful of like continue a healthy routine, I think us also is important for people to be careful not to let fear, as a virus of your mind, to sanitize your mind and keep yourself sane in the sense that you're not really absorbing too much negativity through like maybe social media or news channels or media channels that tend to blow up things just for more viewers. So just be very aware of that, drink your water, stay away from people, exercise, do some kind of mindfulness practice that you may have. Some people pray, some people meditate, whatever it is. I think now is more important than ever to use this as an opportunity. If you're staying home, now there's things that you never did before because we're so busy. Now there's time to do certain projects and complete things and write and read and learn. So instead of falling into a trap of panicking and fear, how about using this as a positive time to really reconnect with family and friends and learn new skills and stay healthy? Yeah, get your body in shape and all these different things to be more mindful uh, of ourselves.
Yeah, one thing that you said that is very important, I want to emphasize,
Mm,
is being scared and having your stress level go up because of fear
mm,
is actually the worst thing that you could do for your immune system.
absolutely.
So if you're scared of a virus and getting sick, then you're going to be more susceptible to it,
Mm,
because the actual act of being fearful causes your nervous system to release chemicals which cause inflammation and stress in your body, which lowers your immune system, which makes your immune system weak. So it's kind of paradoxical that everyone's kind of has this fear, and that the media is making the fear worse because it's actually suppressing people's immune systems collectively.
Interesting. Yes, so I think this is a really important point for people to keep their mind and their body healthy at this time and use this time to do something that they originally wouldn't have time to. And yeah, I think this is great. Thank you so much, Dr. Mark Chavez, for your time, for explaining, from your point of view, what is going on and some tips to stay healthy. And please follow Dr. Mark on Health MD on Instagram, Facebook. You can also find gravityball.com. And stay healthy, everybody. Thank you, Dr.
Yes,
Mark.
please. And last thing I would like to say to everyone is, as you said, you can either do two things with the time that you have now. You could do things that damage your body, eat bad food, watch a lot of television, stay up late at night.
Drink alcohol. I see a lot of people joking about drinking alcohol and partying right now. I mean, that's the worst thing you can do for your body.
Yeah. So the most important three things, we already talked about controlling your stress. The other one is really get your sleep, not just good, but get it consistent. Because normally our schedules are not as consistent as they are now. We kind of know what to expect more on a day-to-day basis than we did before. So it's a perfect time to get your sleep consistent and good. And then what you put into your body, as you stated, alcohol is probably not the best thing to put in your body. If you're worried about getting sick, then you want to get the right things in your body. You want to get the right sleep, and you want to control your stress.
Wonderful. I think we're going to have to do another talk soon about this, maybe about what nutrition would look like, or maybe some ideas for exercises. There's just so much to talk about. But I really appreciate your time today, and hope to talk to you soon.
Sounds great. It was fun. Thank you.
Thank you. Take care. Bye.